Hey, this is Rachel and Jesse, and today we are going to be talking to you about lysergic acid diethylamide, also known as LSD.
Okay, so Albert Hoffman, a chemist from Sandoz Pharmaceuticals, synthesized LSD for the first time in Basel, Switzerland. He accidentally consumed LSD and discovered that it produced vivid hallucinations. It was used in experiments through the 40s and 60s because of its similarity to chemical in psychosis. LSD was popularized in the 60s. Timothy Leary, a psychologist, encouraged American students to turn on, tune in, and drop out, which created a counterculture of drug abuse from USA to the UK and the rest of Europe. It was seen as a chemical weapon by the military because it impacted planning and judgment, creating apprehension, confusion, and terror. The use of LSD decreased in the 80s and increased again in the 90s. Albert Hoffman, after taking a 5-year break from LSD, did further testing. He started to feel dizzy and was in a dreamlike state in his own house while studying this. And the next day, he purposely dosed himself with 250 micrograms, which is 10 times what the minimum dose is that is used today. He became delirious and panicked and called the doctor. The doctor said that there was nothing wrong except he had dilated pupils. Albert told Sandoz of his discovery, and after more research, they decided to call it Delicid in 1947 and sold it as 25 microgram tablets for analytical psychotherapy. In 1949, Delicid was used in hospitals, and in 1966, Sandoz stopped making it, and thus the birth of illegal LSD production. Humphrey Osmond was one of a small group of psychiatrists who pioneered the use of LSD as a treatment for alcoholism and other mental disorders in the early 1950s. Osmond collaborated on experiments using LSD. He took it himself and concluded that the drug produced profound changes in consciousness. He discovered through volunteers that LSD induced new levels of awareness, potentially having the therapeutic potential. In 1953, he gave patients alcoholic LSD, and one patient immediately stopped drinking, and 6 months later the rest followed. He concluded that LSD could be effective, and in 1952, Ronald Stanson from the UK used LSD to treat patients in conjunction with psychotherapy. Researchers are not 100% sure what LSD does in the central nervous system or how it causes hallucinogenic effects. They don't know this because there aren't studies on how LSD affects the brain. It's believed that LSD works similarly to serotonin, and serotonin regulates mood, appetite, muscle control, sexuality, sleep, and sensory perception. LSD may inhibit neurotransmission, stimulate it, or both. It affects the way the retina processes information and conducts that information to the brain. LSD is metabolized in the liver and excreted in the urine. A small amount stays in the body for a few weeks. Some people believe LSD stays in the brain and releases molecules of it. This results in flashbacks that can be from seconds to hours long. Some people experience HPPD, which stands for hallucinogen persisting perception disorder. LSD doesn't seem to be physically addictive, although tolerance to the drug can develop in as few as 3 days, but it disappears after a week of abstinence. It produces sensory distortions, hallucinations, and euphoria. It causes dilation of pupils, increased blood pressure, and increased heart rate. LSD affects a serotonergic system in the brain, but it's unclear how it modifies behavior. There are some theories, though. One theory is that LSD is a serotonin antagonist, specifically activating 5-HT2 receptors. This would prevent serotonin from having its normal effect. The general theory is that LSD is an antagonist and is consistent with how it affects behavior. LSD seems to increase sensation, heart rate, and blood pressure, all of which are excitations of the nervous system. Because serotonin is an inhibitory neurotransmitter, antagonism of serotonin would result in an increase in neuroactivity. The issue with this theory is because the 5-HT2 receptors, antagonism of serotonin at the receptors would result in a decrease in neural activity, which would not explain the effects of LSD. These theories only allow the scientists a glimpse of the whole picture, but in reality, all their theories have evidence that contradicts the theory. One approach to find more information about LSD action would be to investigate where the different 5-HT receptors are located, and this might shed light on the purpose of the receptors.
Oh, okay, wait. Next one. All right, so I'm going to talk a little bit about the mechanism of addiction of LSD. So it turns out that LSD isn't actually physically addictive. Okay, addictive. It's not actually physically addictive. You can be, I guess, addicted to the psychological aspects of it. You know, you can be kind of get a dependence to the feelings that it gives you, but you won't actually go through physical withdrawal and you won't actually be hooked on it. Therefore, treatment for LSD is based on psychological treatment. So why are you doing this drug? Trying to combat that problem instead of just stopping you from doing the drug. However, you can build up a high tolerance to LSD. So the more LSD you take over time, the less of an effect it has on you, as this graph is showing. So you might need to take more and more, and that can get very dangerous. Yeah. All right, so treatment and intervention. There are a couple treatments, actually there are many treatments that work, and I'm going to talk about the two main ones, which is behavior modification and therapy. So behavior modification is trying to find other ways to relax and to replace the time that you would spend doing LSD with other activities. So trying to combat that issue. However, in this instance, the person must want to stop using LSD or else it will not be effective. Another aspect is counseling. So LSD may be a self-medication for depression. So people who are depressed are looking for this kind of escape or this relief, and they find that through LSD. So maybe combating the depression will stop people from wanting to use LSD. Also, no longer using LSD and no longer having its effects can, I lost my notes. Oh, did you pause it? Okay. Okay, hi, I'm back. I found my notes. So also, no longer using LSD, no longer getting its effects, that can result in depression. So treating that can also be used as a treatment. Also, there are a lot of psychological aspects, as I've said, of LSD. So the hallucinogenic nature of LSD can result in paranoia. So that might need to be treated. Also, there are acid flashbacks. So let's say it was a bad trip, you might have flashbacks to it, and that can result in irrational fears and other problems. The most important way to get treatment for an LSD user, if they are not aware of the problem or do not want to get help initially, is through an intervention, as this How I Met Your Mother picture shows. Great show, you should watch it. So basically how it happens is you can contact a drug treatment facility and an intervention specialist will help you along the way. And basically friends and family members will calmly explain to the addict why he or she needs to seek treatment for the LSD addiction. And some addicts may get very angry and some might agree to go get treatment, some might be compliant. So it really depends, but you just kind of have to deal with the situation. And yeah, I think that's all we have for LSD. Here's our bibliography. Thank you for watching.